At Clark Alliance Services, the health of your residents is our mission. We bridge the gap between a physician's care and an individual's next doctor's appointment. Clark Alliance Services provides a broad array of medical services that extends quality care from the physician's practice to the community setting. If you're running an independent living facility, this care keeps your residents healthier and it takes some burden off of your already stressed and overworked staff. These programs are typically covered by insurance and are offered directly to your residents so they can opt into this increased level of care. The three categories of service include Transitional Care Management, Remote Patient Monitoring, and Chronic Care Management. Transitional Care Management, or TCM services, cover a 30-day period after a resident's discharge from an inpatient or partial hospitalization setting. TCM covers any potential gap in care with professional health care in the community setting. With Transitional Care Management, your resident maintains a standard of professional care with a consistent flow of data and updates on the patient's condition. Literature shows significantly decreased hospitalization with all three of these programs, allowing for extended, healthier, and independent periods, and increased assurance for both your residents and their families. Remote Patient Monitoring, or RPM, is structured to provide consistent, long-term care for conditions that could worsen significantly if not monitored properly. When one suffers from illnesses such as congestive heart failure, diabetes, hypertension, COPD, or obesity, the patient's life could be at stake if that illness is not properly monitored and treated. We monitor an individual's health, including key indicators, in order to better advise and educate them about their illness between doctor's visits, and we provide reliable data for the primary healthcare provider so that they can monitor the patient's condition as well. Chronic Care Management, or CCM, is needed when an individual has a more acute need for monitoring and care of two or more chronic conditions such as Alzheimer's or other dementia, arthritis, asthma, atrial fibrillation, autism spectrum disorders, cancer, cardiovascular disease, COPD, depression, diabetes, hypertension, or other long-term infectious diseases. CCM allows for extended care by a physician or other qualified healthcare professional where a significant risk of death or functional decline is involved. Clark Alliance Services provides Transitional Care Management, Remote Patient Monitoring, and Chronic Care Management services to give your residents and their families peace of mind, and it gives their doctors the information they need in order to provide the best care possible. These services also allow your staff to focus on their daily tasks, reducing the number of urgent care issues in your facility. We look forward to providing specialized care to your residents. Please contact Clark Alliance Services at 757-276-5020 to schedule a consultation or visit us on the web at clarkallianceservices.com.